My name is Justin Garnell. I'm a registered nurse dedicated to performing life saving skills to some of the sickest patients in the hospital, the ICU. As a general rule, air goes in and out and blood goes round and round, or at least until it doesn't. Would you know what to do if you witnessed someone collapse in the grocery store as their children stand there frantically crying for help? Would you jump into action or would you run away scared? But with help from others and some mechanics of life saving skills, you may be able to help save someone's life one day. There are three simple steps we need to explore. Well, the air goes in and out, doesn't it? When a person takes in a breath, they're breathing in oxygen. And when they're exhaling CO2. The CO2 O2 exchange is what we call homeostasis. And how important is the CO2 O2 exchange? Well, according to the University of Michigan Transplant Center, 1 minute without breathing, brain cells begin to die. 3 minutes, serious brain damage is likely. And after 10 minutes, many brain cells have already died and the patient is unlikely to recover. After 15 minutes, recovery is virtually impossible. So, what can you do? You can simply breathe for them. Tilt their head back and deliver a breath for at least 1 second, allowing chest rise. And then just simply allow the air to exhale on its own. What you would do is give 2 breaths after every 30 compressions. So, compressions, that's our next point. Blood goes round and round. The heart is a two-way pump. Oxygenated blood is carried from the lungs to the left side of the heart where it's pumped to the body, to the cells. O2 is offloaded, CO2 is exchanged, and it gets pumped back to the right side of the heart where we breathe it off. So during cardiac arrest, the heart's no longer pumping blood. So there's essentially no O2 and no CO2 moving, and we're not creating a homeostasis. Chest compressions can get the blood moving around the body. Remember that the heart's a two-way pump, and when we press down on the chest, we're pushing blood to the body. And when we're getting off the chest or allowing a recoil, blood is coming back to the heart. So we need to make sure we're pushing down and fully coming off the chest at the same time. The American Red Cross says we should compress the center of the chest at the nipple line for a rate of at least 100 compressions a minute. We will need to compress the chest for at least 2 inches, allow full recoil, and deliver 30 compressions followed by 2 breaths. Early defibrillation is our last point. Defibrillation occurs when the body's in what we call ventricular fibrillation. Basically, the heart's in a deadly arrhythmia where the heart's just shaking and nothing's getting pumped. That's the fibrillation. The defibrillation occurs when the AED, or the automated external defibrillator, delivers a shock to the heart to make it stop fibbing, defib, and allow the heart to return its normal cycle. So AEDs are very expensive and they can cost over $1,500, which is why you only see them usually in a hospital or on an ambulance or in a store. So according to the American Heart Association, defibrillation provides the single most important therapy to anyone in VFib. So in order to get this defibrillation here early, we need to ask for it early. So in our summary, we have it 3 simple steps to jump into action to save anyone's life, or at least try. If we witness the cardiac arrest, we call 911 and shout for help. Hey, somebody help me, go get the AED, call 911. We check for a pulse. If no pulse is present, we go ahead and start our chest compressions at a rate of 100 compressions per minute delivering 30 compressions and 2 breaths. We just continue repeating that cycle until the AED arrives, delivers a shock, or the patient says, "Stop, you're hurting me." You can obviously stop CPR at that time. Your actions might be the last chance of survival for someone you know or someone you don't know. What would be your choice? If you find this interesting, attend a CPR class and get more involved. Thank you.